Good morning. My name is Robin McNeil. I am here to present the 1-hour course for Mouth Care Matters. This course is named Healthy Mouth Equals Healthy Life, Oral Health, the Path to Good Oral Health for Those Who Care for Others. This is a sampling of what Mouth Care Matters has to offer for courses. At the end of this course, I will give you more information on other ways that you can get more information about Mouth Care Matters and things that they offer. Mouth care is important. Mouth care affects obviously the mouth, the brain, and the whole overall body. In this course, we're going to talk about 3 different categories. We're going to talk about homebound patients, we're going to talk about long-term care patients, and we're going to talk about community living patients, as well as a lot of different aspects of oral care and the oral cavity. For homebound patients, we want to talk about just a few statistics to help you understand what possibly those patients could be going through. 40% needed restorative dental care, 45.6% needed dental extractions, 33% complained of current oral pain, 92% needed some type of dental care, and 96% stated that they had not seen a dentist since they became homebound. Oral health status was poor, and quality of life was significantly affected. This was taken from a study back in 2012. And so as you can see, homebound patients can be found in a variety of statuses, and more than not, there are dental needs that are needed by these patients, and they may have not sought dental care in quite some time. So long-term care or nursing facility patients, 33% needed restorative dental care, 33% have lost all of their natural teeth, 26% had severe gingival inflammation, 29% have substantial oral debris, and significant dental care in the past, limited financial resources, and ensured daily preventative care. So this was back from 2012. These stats may have now, again with the homebound as well, may vary. I would say since the pandemic, definitely these stats are going to be altered. Lots of people did not receive dental care during the pandemic due to either easy access to care, fear of getting sick. And so there's definitely going to be some difference in the numbers here. The major difference between nursing facility and homebound is typically at a nursing facility, there is someone that's overseeing their care on a daily basis, where homebound is left to be more independent. Community living, so that would be more the group home setting. And this setting can look very different depending on the abilities of the resident of this setting. Some residents are considered independent, some need some assistance, and some are completely reliable on caregivers. There's different challenges definitely for community living versus long-term care versus homebound. They each have their own challenges. Typically with community living, you're dealing with challenges with adults with developmental disabilities. So obviously the solutions must be tailored to address the different experiences and distinct needs of the family members and paid caregivers who assist these adults. Caregivers reported 85% of dentate adults, meaning adults with teeth with developmental disabilities, received assistance with tooth cleaning. Also reported a high prevalence of dental problems, a low adherence to brushing, 79%, and flossing, 22% recommendations. This was from JADA in 2014. I work at the University of Iowa as a clinical dental hygienist in the adult special needs department, geriatric and adult special needs. And I would say most of my community living patients, I would say definitely do need assistance with their brushing. And we do see a lot of poor oral hygiene. Along with the other settings, the homebound and the long-term care, a big problem has been staffing and consistent staffing at these facilities. So that has made a huge difference. as well as the one thing that's a little bit different with community living is, like I said before, there's different, it's typically adults with disabilities, and it's different because these residents can be their own power of attorney, so they can make their own decisions. They can refuse care. They can make it difficult for the staff to assist them in care. So therefore, I would say that definitely most of them need assistance. It is a huge problem to get this to comply to oral hygiene daily regimens, and to have some consistent staff that will follow through with recommendations. So what you should know. So the health of our mouth impacts the whole rest of our body. So typically you'll hear a lot of people talk about your mouth as the gateway to the rest of your body. The reflection of what your mouth looks like may be the reflection on other things that are going on in your body. Systemic health can impact our oral health, and poor oral health can negatively affect a person's overall health and wellness. And we'll get more into that as the presentation goes on. So do you need your teeth? Well, here we have two famous people, Kim Kardashian and President Obama. These are two people that are well known and I would say considered, attractive people. And here they are with no teeth. So definitely for them, having no teeth would be very different for them. And I bet they do want their teeth. Good oral health allows people to eat nutritiously, begin healthy digestion, taste and enjoy foods, smile and speak clearly. So for them, who we just talked about, they do a lot of picture taking, they do a lot of speaking, they're very social. So all these things that we're listing here, self-confidence, all those things are so important, and those are things that they're well known for. Good oral health for people that wear dentures, make them more comfortable to wear their dentures, prevents bad breath, and maintain that attractive appearance, which for them, would be super important. What is plaque? So plaque is that white, sticky, soft substance that's left on your teeth after you eat and has not been brushed off. So in the top picture here, you can see that that's a lot of plaque. So that's not just from one misbrushing or one meal. That would be from multiple misbrushings and multiple meals. But that gives you a good picture. If it accumulated, that's what it would look like. It's a biofilm, contains saliva and debris. It's soft, sticky, typically colorless unless it builds up like that top picture, then it becomes a white substance. Deposits where tooth and gums meet. And then, fun fact, every 4 to 6 hours, 20 billion bacteria replicate in the oral cavity. So there is a lot going on in the oral cavity. We'll get to more of that in just a little bit, but you can see how that bacteria plays a huge role. So more about these organisms. The mouth houses the second most diverse microbial community in the body with over 700 species of the bacteria and 85 different fungi. So again, there's a ton of organisms going on in the oral cavity. Every 4 to 6 hours, 20 billion bacteria replicate in the oral cavity, like we just said. So, man, that's not a lot of time, and that's a lot of bacteria. When the balance of microorganisms is upset, usually from poor oral hygiene, disease may result. So you can see how fast that disease may result by not getting your teeth clean, because think about how many bacteria replicate, and that transition is every 4 to 6 hours. So here's a little graphic to explain tooth decay. So all those germs and bacteria that we just got done talking about, with the plaque, they're going to combine with carbohydrates. So it does not have to, sugar gets a bad rap, but it does not have to be a dessert or a candy. It's any carbohydrate. Carbohydrates are the biggest factor in meeting with the germs and the plaque to create that acid. And then on the second row, so the acid that's created combined with sitting on your tooth then creates the tooth decay. And that's only if it's sat on there, has not been brushed off, high amounts are coming in contact with your tooth. Tooth decay. The form of food matters. So obviously, if you have more of a stickier food, it'll stay on the tooth longer. How often cavity producing food is eaten matters. So for instance, acid stays in the mouth for several minutes. So let's take, for instance, let's say you're drinking a Mountain Dew. It's much better to drink that Mountain Dew down in one shot than to sit there and sip on it for an hour to an hour and a half, because you keep reintroducing that acid on your teeth. Limit the amount, sugary foods and drinks to mealtime. So again, it's kind of that same thought of, if you have it with your meal, it's at a concentrated time. Therefore, it's not being reintroduced over and over. So now we're going to talk about diseases of the gum tissue. And remember that gum tissue is that pink tissue that surrounds your teeth. There's two different kinds of diseases with gum disease. There's gingivitis and periodontitis. Gingivitis is infections in the gums caused by bacteria. Bleeding and swelling are involved. Gingivitis is the first stage of gum disease. And at this stage, it can be reversed by good oral care. So that brushing and flossing can take infected gums back to healthy gums. Once it's sat there and developed, it can develop into a chronic disease, which is called periodontitis. Once it hits periodontitis, it is not reversible. So therefore, the damage has been done. And now you're going to talk about there's now destruction to the ligament and the bone around the teeth. So if you look at the picture here on the left side, I want you to pay attention to where the pink area is, and then under the pink area is the bone. So on the left side, the tissue is farther up on the side of the tooth, the bone levels are higher. Well, once you hit the periodontal disease part of it, then you'll notice on the right side, it's now destructed that tissue. The tissue has recessed and the bone level is starting to be eaten away. So if you've heard of somebody that talks about they hadn't had a cavity in their life, but they lost their teeth, that would be somebody that had periodontal disease because the gum loosened up, the bone was eaten away, their tooth became mobile, and they started losing teeth. So what about dentures? What if you have no teeth? Do you have to take care of your mouth? Absolutely. Just because you don't have teeth, you still have to brush your dentures and you still have to make sure your tissues are clean. And we'll get into that more in just a little bit. So that mind-body connection. So there's the saying, what happens in Vegas stays in Vegas. Well, what happens in your mouth, we don't want to stay in your mouth. We want that to get out of your mouth because remember, that can travel to the rest of your body. Mind-body connection. Okay, so now we're going to talk about what is that. So the germs, all of that bacteria we talked about, all the billion of bacteria that were coming every 4 to 6 hours, if left on your teeth, can enter the bloodstream through infected gums. So once you've let that sit there and your gums become infected, that infection, that inflammation now has the potential to travel through your body. It can travel to multiple areas. It can reach your heart, lung, kidneys, brains, and joints. And you think about it, for people who are frail and elderly, those are common areas that are affected as they get older, that they typically have problems with. So again, so important to keep the teeth and gums healthy so they don't continue to compromise these areas. So daily oral care. So I bet you didn't think about that gum disease and tooth decay are both bacterial infections. So the same thought for if, let's say this is a wound on the skin, it's the same kind of wound or infection that's happening in your mouth. So as a caregiver, if we had a wound like this on our skin, we wouldn't ignore it. We would clean it, we would treat it, medicate it, and get it healing. We'd be checking on it. So same thing in the mouth. So if you think about that resident or that patient or person served who cannot advocate for themselves, if that's sitting in their mouth, that's just like a skin infection that's just sitting there festering. So we're going to talk about different mouth and systemic connections. So first is diabetes and obesity. So it's a two-way street. Inflamed Increased inflammation from gum disease can impact blood sugar levels. So those A1C scores, typically the cleaner your mouth is, the healthier your mouth is, it's going to help your A1C score. And the reverse of that is if your A1C score is high, that potentially is going to, that inflammation created by that imbalance of blood sugar levels also can affect your mouth. Lung conditions, pneumonia. So we've all heard of aspiration pneumonia. Bacteria breathed into the lungs can lead to pneumonia in medically compromised people. So again, that bacteria, that yucky picture we just saw, we don't want that bacteria sitting in the mouth because that can be breathed into the lungs and cause some serious problems. Sepsis and infection. Emergency department visits for dental abscess and pain. Oral infection can become severe, increasing cellulitis and sepsis from infected teeth and/or tissues. So again, this can be a serious situation. Pregnancy. Periodontal disease in pregnant moms increases risk of low birth weight and preterm birth. So again, even though it's the mom that has periodontal disease, through that crossover to the baby, that can also affect the baby's health. Heart conditions. Bacteria in the bloodstream travel to arteries and then can cause all different problems with the heart and the hardening of the arteries. Same kind of thing. The plaque that collects in the mouth, it's a similar process to plaque collecting in those arteries. Immunosuppressant conditions and treatments. So the inflammation in the mouth can compromise arthritis patients, transplant patients, and cancer patients. Healthier their mouth is, the better chance they have to fight these diseases. Brain health, dementia, mental health, behavioral health, brain injury. Again, same thought, that inflammation can travel to the brain and it can compromise these situations as well. So remember we talked about lungs just a minute ago. So aspiration pneumonia, #1 cause of death in nursing homes. Failure to remove germs in the mouth is a significant risk factor for aspiration pneumonia. Proper oral care can decrease mortality rate up to 50%. So a big deal. I mean, this can be prevented just by good oral health. So here's some facts from hospitalization, and this is hospitalization, aspiration pneumonia, and the NV, that is pertaining to ventilation, whether they need ventilation or not, accounts for nearly 25% of all hospital-acquired infections with a mortality rate of 20 to 33%. Diagnosed 48 hours after admission, extends hospital stay by 7 to 9 days, and can cause death. Modifiable risk factors, oral care, ambulation, head of bed elevation, patient and family education. So here we can see the cost and the staffing and what we have to do to help these patients, and that there's a lot of things that we can do to care for them to prevent this disease. We're going to talk a little bit about COVID since it's in our lives every day, and make sure you have the latest information. The bacteria associated with periodontal disease and gingivitis has an immune suppression effect that can increase our susceptibility to cold and flu viruses like influenza and rhinovirus. Aspiration, breathing in bacteria and viruses into our lungs, can affect respiratory health and increase the risk for pneumonia. COVID-19 has significant respiratory effects, so you could see how those two could be linked. Coupled with oral health, could significantly impact the symptoms associated with COVID-19. So again, the healthier their mouth when they get these type of things, helps them recover. If your immune system is weak or you have a chronic disease such as heart disease, asthma, lung disease, or diabetes, it's important to have a healthy mouth to protect your immune system, enable your body to protect you and those you serve. So again, it's that mouth-body connection. And just a reminder to protect yourself, obviously, to wear a face mask and gloves, goggles, face shield, wear a gown when you provide for others, change when it becomes soiled. These are things that you all know, but just a reminder to protect yourself. So now we're going to look at conditions, normal versus abnormal. So we're first going to look at the lips. So we want the lips to be soft, moist, pink, pliable. So on the left hand side is the healthy mouth. This is a patient of an elderly patient. So their skin obviously is going to look different than someone who is younger, but their lips are still smooth, pink, and moist. So we could move their lips around when we open their mouth and have no problems. Changes. So now dry, chapped, or red at the corners. So when you start to see changes in the lips, that's important to note. So one thing is the dryness. That could be a sign that also that they have dry mouth and they need more hydration. They also could need some kind of treatment to their lips for the chapping. And then the redness at the corners, you want to pay attention to because that can split open, that can become scabbed and become a medical situation. And once that redness at the corners happens, it can be very, very painful for the person served to open their mouth, to brush their teeth, eat, speak, all of those things. So on the unhealthy slide here, you can see that there's an ulcer on the lip. You can see there's a lesion on the lip. And then in that top left, that's where that redness is now become scabbed and therefore now needs medical attention. Anything that you question, please observe and report. Natural teeth. So healthy teeth can look, again, all different kinds of variations of shape, sizes, and gum tissue can vary in color as well. But the important thing we're looking for here is with the teeth, we want to look for that we don't see any signs of decay. There's no broken teeth, no root tips. So the middle slide shows some teeth that are decayed. Now the decay in these slides are advanced, and obviously we don't expect that you're going to be able to detect anything on the early side of decay. But if you see teeth that are broken, you can see teeth that are real discolored like that top slide, or the bottom slide shows in the back there where teeth were there. You can see remnants, but they're now totally at the gum line. So those are all things when starting to serve a person that are things that you want to note. And then on the far right slide is more of an advanced decay situation where it shows multiple teeth that have decay, obviously poor oral hygiene. Again, that's something that you'd want to observe and report. So now we're moving on to the tongue. The left side, again, is that normal. You want it to be moist. You want it to be the same appearance for the entire tongue. You want it to be pink. There's a roughness to the tongue. And that's the little papilla that are on top of the tongue that give you that roughness. So the middle slide is patchy, fissured, red, and coated. So the bottom slide is showing you a fissured tongue, but it's also coated. And then you can see towards the back of the tongue, there's a little bit of brown there. So that's a bacteria buildup that's on the tongue because the tongue's not getting cared for. And the fissured on the tongue is a sign of dry mouth. The top slide is red. You could see that it's lost that appearance of moisture. It's fissured, it's glossy, it may be painful to the patient. Again, that's something that you want to observe and report. And again, this person could be the person that has a hard time speaking, eating, opening their mouth. All of those things are painful. The right-hand side is more severe cases. On the bottom is, again, a lesion. The middle slide is where they've bitten their tongue. And the top slide, again, is more advanced, like a burning, could possibly be a burning tongue, dry mouth, fissured tongue, all of those things. And again, those would be all situations where patients may have a change in diet. They may be not as verbal, don't want to drink, eat, or do oral care. Gum and tissues. So on the left-hand side, we're looking at now the gum tissue. We want it to be pink, moist, smooth, and no bleeding. And again, different people from different nationalities can have different coloring with their gum tissue, but the most important thing is no bleeding. That'll be a good sign of whether your tissue is healthy or not. The middle slide shows, obviously, there's debris on the teeth. The top slide, you can see a little red ring around each tooth, and that's that gum inflammation. The bottom slide is a denture patient that you can see there's kind of a red circular area there, and that would be a gum infection or ulcer where their denture is ill-fitting or rubbing, and they now have a problem with their gums. The right-hand slide shows you different things. The bottom one is a denture patient that now has a fungal infection. The top slide is also a fungal infection on the cheek and the tongue. And then the middle slide is advanced gum issues where they have moderate to severe inflammation, obviously lots of deposit on their teeth, probably someone that hasn't had their teeth cleaned in a long time. Saliva. So the normal amount of saliva, you want to have moist tissues, watery, free-flowing saliva. Typically, the patient says that they do not have dry mouth or problems with dryness. The middle slide is signs of dryness where their saliva is thicker, or all of a sudden you see that their tissues are not moist anymore. They're starting to shine because they're a little bit irritated from the lack of moisture. On the right-hand side, you'll see some more severe cases of that fissured tongue, that dry mouth, and you can see the lips have the cracking in them. And then the bottom is just a disaster. It's everything. It has sores, dryness, lips are a mess. Again, any of these situations you'd want to observe and report. So what to do if you're not sure if something is normal or healthy? Well, one, each facility has their own action plan, and so make sure that you follow the plan of action at your agency or facility to report concerns or findings. But if there's something that you're unsure about, observe and report it. That's the best thing to do. So this is we're including this in here so you can see when somebody's coming to take a data set on residents or people served that you work with, these are things that they're looking for. They're looking for if they have any broken or loosely fitting full or partial dentures, no natural tooth or tooth fragments, abnormal mouth tissue, obvious or likely cavity or broken teeth, inflamed or bleeding gums or loose teeth, mouth or facial pain, discomfort or difficulty with chewing, unable to examine, and then obviously none of the above were present. They were considered a healthy mouth. And this is an example of a screening sheet that can be used. And again, they're just going through different categories: the lips, the tongue, the tissues, the saliva, the teeth, dentures, oral health, and dental pain. So this is a checklist that can be used. Each agency that would come in to do dental screenings uses their own forms, but this is a form that we gave you as an example, just so you could see what are things that us as dental professionals are looking for when we come to serve your people. So obviously saliva is very important. This poor dog, he needs a lot of saliva. His tongue is hanging out. He wants saliva, he wants water all the time. So gets food ready to be swallowed for good digestion, makes the mouth less acidic, strengthens weak tooth enamel, keeps the mouth moist so it's easier to eat, taste, swallow, and speak. So common causes of dry mouth, and dry mouth is also known as xerostomia. Medications: cancer and radiation treatment, dehydration, alcohol use, smoking, mouth breathing, and age. So medications, there are a huge list of medications that are involved with dry mouth. Probably all of us are taking at least one type of medication that can potentially cause dry mouth, whether it's an allergy medication or a medication for a medical condition. There's so many medications out there that can cause dry mouth. Aging, as people age, their mouth does become drier. And then obviously, if you are a mouth breather, or let's say you sleep with your mouth open, you will notice that your mouth is very dry in the morning, and that can affect a condition of dry mouth as well. So products that you can use for dry mouth. So you can sip water throughout the day. There's mints and gums. Obviously, you want to brush regularly, keep all that bacteria and plaque out of there. So if you are going to use, it says do not use cough drops or hard candy. You can, but just make sure that they're sugar-free. And then use products designed for dry mouth. That would be alcohol-free products, toothpaste, sprays, and gums. So alcohol-free, you want to make sure that your products do not contain alcohol. The alcohol would be more drying. The toothpaste, if you're someone that is someone that you would consider has dry mouth, maybe has a lot of mouth sores or mouth changes, I would stay away from products that have a lot of ingredients in them. For instance, you're having something that has this and plus whitening plus something else that can really irritate the mouth. I would look for what's called an SLS-free toothpaste, and that's just basically means that they're taking a sulfite out of the toothpaste that can sometimes irritate the mouth. If you're looking for a specific dry mouth toothpaste, they typically are SLS-free. And then there's also sprays and gums, or sprays and gels out there. The gels I really like, they come in a little tube, and you just put some on your finger. You can wipe it on your tongue. You can wipe it inside your cheeks. You can do it as many times of the day as you want. That doesn't really have much of a taste to it. You can get flavored ones. I've had both. I've tried both of them, and neither one of them caused a problem. So feel free to give those a try. So now there's the patients that have oral problems, but they can't advocate for themselves, or they're nonverbal. So things to watch for are weight loss, becoming agitated at mealtime. So remember that person that had the cracked lips or has the sore tongue, that would be an indication that maybe something's going on. They're refusing to eat. All of a sudden they change their food preference. Maybe they have a sore tooth and they no longer want their regular diet. They only want soft foods. They're touching their cheek or their mouth more often because they're, either in pain or trying to figure something out with their mouth. Swelling, uneven facial features will be an indication that there could be an infection going on. If they're warm, puffy cheeks or chin, that also could be a sign of an infection that's going on. All of a sudden they refuse to wear their dentures or are removing them to eat. That could be a sign that they have an ulcer or a sore, or their denture is rubbing somewhere. Again, that would be something you'd want to observe and report. Or the resident who all of a sudden you do oral care for them every day, or it's a new resident that you're just starting to do oral care for, and you're just like, oh my gosh, what has happened to their breath? And I will say anybody that's had this, they will know, because it stops you in your tracks. And it's not just bad breath, it's really bad breath. Like there is something serious going on in there. And if that is the case, again, I would observe and report. So proper oral care. So on the left, it shows a person served before brushing, and then on the right, it's after brushing. Things to note is obviously the debris is gone, but you will notice there's some bleeding at the gum line. That is normal, because remember when we showed that picture of the skin wound? So if you were going to clean that skin wound, you would have some bleeding, right? When you're cleaning that wound, that's the body's natural way of cleansing itself, flushing out that wound. Same thing with your teeth. Until the gum tissue is healthy, you're going to go through a stage where the tissue is going to bleed when you brush the teeth. You're not hurt. That's a natural process. So don't stop brushing because you see blood. Now, if a resident seems like they're in pain, you may have to adjust your pressure of brushing. but the bleeding is not something that you're not causing the bleeding. The bleeding is there because of the bacteria buildup and the debris buildup. Denture care. Remember back when we talked about, do you have to care for your teeth if you don't have teeth? Absolutely. So here is a person that has denture stomatitis. That's a fungal infection where their denture sat. And so if you look on the left, you see the set of dentures that had not been cleaned. This is what can happen. They don't even have to look that dirty for this to happen. But it's important that the person served is taking their dentures out at night to let their tissues breathe and get a rest. But they also need to brush their dentures thoroughly, just like they brush their teeth. There are special denture brushes out there. If they don't have one, of course, they can use their toothbrush. But there are special denture brushes out there. But you do not want to use your denture brush in your mouth, only on your denture. And then as far as the tissue in your mouth, any food that would be left over from a meal, you want to make sure is removed from the mouth. One, you don't want that food and bacteria sitting on the tissues. And number two, you don't want the resident to aspirate any food packing that would be left in there when they sleep. So oral care success. So there are some people served that are harder to care for than others. And this is a challenge by many people. These are some things to help you consider. The time of day and the location. You may have to select a different time of day and location. And we want to make sure that sometimes people will think, oh, you're only supposed to brush in the morning, or you're only supposed to brush at night. The most important thing is that the patient's getting brushed. So if right away in the morning, this patient is always agitated and it's not a good time to try to brush their teeth, then try an hour later or 2 hours later. But the most important thing is that they get their teeth brushed. Make sure that you have a positive attitude about it. Explain what you're doing. And I do this even to people served who are the unconscious patient, the person who's on hospice that no longer can respond to me, talk with me. I still treat them like they're awake and that they're with me. I let them know who I am. I let them know what I'm going to do. And then I, step by step, give them prompts of what's going on. Some people like them to have songs as a distraction, or if, for instance, if you're dealing with someone with special needs, they're really adamant about knowing when things are going to start and when things are going to stop. So maybe if there's a certain song that you sing that's a certain amount of time, and they know when you get done with the song, their oral care would be done. That's a good method to use. Or a visual timer. Visual timers are great because some people don't want to hear you sing a song or are sensitive to sounds, but they like visual things. And so they'll watch this light that flashes and they know when it turns colors, you're almost there. And then when it hits the last color, they know that, okay, we're done. So just some suggestions for you. Some people like to hold a familiar object or stuffed animal. And then positive reinforcement. Even if I have the person that's most defiant, I still am positive about it. There's something that they're doing, whether it's even them letting me get the toothbrush in their mouth, I reinforce that. So try to find something to reinforce to make it a positive experience. So what is your role as a direct care worker? Well, decide, can the person served brush independently? And this is a big consideration because you have to ask yourself, is the person putting the toothbrush in their mouth and brushing some of their teeth considered independently? For instance, I have a son with special needs. He can put a toothbrush in his mouth, but he tends to want to only brush 2 parts of his mouth. That's the part that the 2 that he always goes to. So if I or my husband wouldn't be there to prompt him to move to the other areas, he'd only brush those 2 areas of his mouth. So I wouldn't consider him an independent brusher, even though he can run a toothbrush independently. He's not an independent brusher. Prompt, assist, or perform oral care daily. So find out what is the best thing for your person served. Is prompting all you need? Do you need to do a roux brush? Or do you totally need to perform the care? Follow recommendations made by the dentist or dental hygienist. Watch closely to see if there's any changes in the mouth. And remember, we're looking for the lips, the gums, and the teeth. Know protocols on how to handle oral health situations. So whatever your agency, whatever their protocol is or plan of action to observe and report, follow those guidelines. It takes a village, so it takes all of us to get this accomplished. It takes nurses, dietitians, social workers, occupational therapists, physical therapists, direct care professionals, dentists, dental hygienists, and physicians. And communication is so important between all the team members. Also family members. We all have to respect and trust each other and our expertise and what we have to bring to the communication for the person served. Documentation is so key. Frequent team or family meetings for update and changes, and education. And that's why you're here today, is to get more education. And daily oral care is infection control. So healthcare workers think of infection control in many ways. We may think of, wiping the counters off in the room is infection control. Cleaning a wound is infection control. Well, daily care is also infection control. Thank you very much for coming today to watch this presentation. Like I said, this is just a little sample of the information that you can get from Iowa Caregivers in the Mouth Care Matters series. For more information about Mouth Care Matters, you can either go to their website, you can call their phone number, or you can contact Pam Bilkin. She has an email address and her phone number is there as well, and she can get you in contact with the resources that you need to have further in services. Thank you so much for your time today.